Well, the first stage is to evaluate the patient with them standing up. I'm interested in the patient telling me where their veins are, the ones that are causing them discomfort or an unsightly look to their leg. And then we use the ultrasound machine to identify the underlying anatomy so that I can decide exactly where I'm going to place the needles in the veins. Okay, so we're going to put 1 or 2 marks on the back of the right leg to help me with the position of the cannulas. A picture of the saphenous vein inside the fascial envelope. Then we inject some local anesthetic at the sites of injection. The needles we put in are fairly small, so wouldn't normally cause much discomfort. But in fact, if you're lying there on a bed in a treatment room, having any needle stuck in your leg is potentially unpleasant. So we inject a small amount of local anesthetic at the places where we decide we're going to treat the veins. Then, when we're ready to go, we'll introduce the foam, which is precisely what was done last time. The reason why we're putting several cannulas into the vein is that when we first started doing this, we used to only put 1 or 2 cannulas in the leg, but we found that gave incomplete treatment to the vein. So unfortunately now, on the receiving end, you get more injections, but on the other hand, the outcome is that more of the vein is destroyed, leading to a good long-term outcome. The purpose of elevating the leg is to minimize the amount of blood in the veins we're going to treat. Blood has been shown to inhibit the effect of the foam. It's in fact extremely powerful at stopping sclerotherapy working. So elevating the leg makes the veins much smaller and facilitates the treatment. We use the ultrasound to locate the saphenous trunks, which are usually not visible from the surface. And we can also identify the relationship between the varices and the trunk from which they arise, so that we can place an injection in the right place. Well, we used to inject veins in only one place, which was the original technique, but we found that if we just injected the great saphenous vein around its center, then the extremes of the vein near the groin and towards the calf would often remain untreated and perhaps be the source of further varicose veins. So we now do multiple injections in the great and small saphenous veins, and our usual practice would be to do 2 injections in the great saphenous vein in the thigh and a further 2 in the calf. And the small saphenous vein, we would normally do 2 injections directly into the saphenous trunk, 1 more proximally. And in addition to that, we do injections into all the major varices or major tributaries, depending upon the anatomy. So we finish up on average injecting somewhere between 4 and 8 locations in a limb with varicose veins. Well, we find that after the treatment, after foam sclerotherapy, blood is trapped within the vein as thrombus. And if we don't apply enough compression to the leg, we get a very large amount of thrombus in the leg, and that produces considerable pain, discomfort, even thrombophlebitis afterwards. So putting a firm compression bandage on and leaving it there for 5 to 7 days is a very important part of avoiding that complication. There's a range of opinion as to how much compression should be used. This style of compression will fit under most people's clothes very easily, and we've found that it avoids the tender lumps that some patients get after their treatment. And so we now regard this as a pretty essential part of the management of veins by foam sclerotherapy.